What you need to know about hydrocephalus and how to treat it. Hi, my name is Brian Hoeflinger. I'm a board certified neurosurgeon. I've been in practice for 26 years. And hydrocephalus is a term that just really means buildup of fluid in the brain and in the fluid cavities of the brain, which causes pressure on the brain. Typically, there's different ages people can get hydrocephalus or fluid buildup. When you're a baby, it can be congenital and be born with it. And then kids can get it in childhood, and even adults in their 60s, 70s, 80s can get hydrocephalus. And each age group has different symptoms. A young child may just be a young baby may be unconsolable, cries a lot, won't eat, is sleepy. A child will complain more of a headache, like pressure in the head. They might have associated nausea and vomiting, and they can also be sleepy. And then as you get into the older generation, people complain of difficulty with their memory, they have trouble with their balance, and often they will have incontinence of urine. So each age group has a different presentation. But when you think about treatment, if someone becomes symptomatic from fluid buildup in the brain, there are treatments. You could start with medications. There are certain medications that can slow the production of spinal fluid down. That effect is limited. But usually what it comes to is surgery. And the most common surgery that people have for hydrocephalus is going to be placement of a shunt. So a shunt means that we put a tube into the fluid cavities of the brain, and then we tunnel that tube under the skin all the way down, typically into the abdomen. So you have a conduit set up from your brain cavities under your skin all the way into your abdomen, where the fluid drains and then gets reabsorbed. There are other procedures that don't involve putting in permanent devices. There's a procedure called a third ventriculostomy, where you actually go into the brain cavities themselves and you open up through a membrane into another fluid space where the fluid can drain out. But by far the most common treatment through the years has been a ventriculo to peritoneal shunt, which is the tube I talked about from the brain tunneled down under the skin into the abdomen. And this can be life-saving. For people, shunts can save their life. Some people will die without a shunt. And the nice thing is, if you have a shunt in place that's working, you can live a normal life. You can exercise, you can jog, you can go scuba diving if you'd like. And so it's not something that can hinder your life by having the device in, as long as it's working.